It's important to realize and set your own expectations for the chances of success. I want all of my patients to get pregnant and have a baby with their very first IUI, but I want to help them understand the chances of success, setting their expectations, and helping them realize that it really might take more than one IUI. Welcome to Baby or Bust. I'm your host, Dr. Lora Shahine, and I am tired of infertility and miscarriage being misunderstood, hidden, and full of stigma. Welcome to the podcast with interviews and in-depth discussions on topics all things fertility. Thank you to our friends at Seattle Sperm Bank and Greg Moga for sponsoring the show. Please take a moment to give us a 5-star review anywhere you listen to your podcast. Helps other people find the podcast, and it just means so much. IUIs can work. Many patients ask me if an IUI or an intrauterine insemination is a waste of time, and they ask if they should just go straight to IVF to have their baby. It's important to have a full evaluation and talk through all the options for treatment because IUI is less complicated, less expensive, and it can be the right step for your personal situation. If you're considering IUI, you are going to want to listen to this episode to learn about tips for success. So, first of all, what is an IUI? An IUI is an intrauterine insemination. It is a fertility treatment, and it is often referred to some of my patients with a little bit of a giggle. They call it a turkey baster because basically you're taking ejaculated sperm, washing and prepping it, and then placing that sperm into the uterine cavity around the time of ovulation. And this is a technique. It's pretty low tech in that everything's still happening inside of the body. So sometimes people get confused with acronyms and, IUI versus IVF. IUI, intrauterine insemination, placing sperm into the uterine cavity around the time of ovulation. And IVF, totally different. In vitro fertilization, that's where we give medications. We're trying to recruit a lot of eggs, extract the eggs from the body with a simple procedure called an egg retrieval, fertilize eggs and sperm outside of the body. And then when the embryo is ready, placing the embryo back into the uterine cavity. People are using IUIs for lots of different reasons. Certainly, if someone is conceiving with donor sperm, then an IUI is a great way to help get that sperm near where it needs to be around the time of ovulation to help you conceive. Some people are using it as a low-tech fertility treatment, either for unexplained infertility or helping improve the odds of success with some other treatments, or even mild male factor, meaning there's a low-ish or borderline sperm count, low-ish or borderline motility, and an IUI can help prep the sperm and really get it past the cervix closer to where it needs to be. Now, you do have to have a certain amount of sperm to do an IUI. I do see patients sometimes that do have sperm in the ejaculate, but a very low count, like less than 1 million, maybe less than 2 or 3 million. And in those cases, it is very unlikely to be successful and to get pregnant with an IUI. And so sometimes, of course, if there's no sperm or if there's very, very little sperm, sometimes my patients are going straight to IVF. And IUI is really not an option. So be sure to review that with your doctor. So in general, what happens during an IUI cycle? Well, you're typically just trying to get sperm where it needs to be around the time of ovulation. And so it's timing that placement. Sometimes people will follow their cycles with ovulation predictor kits, call the clinic with a positive kit and do the insemination the next day. Sometimes people are using ultrasounds to help monitor, even trigger shots to help time the insemination. But you're trying to figure out when ovulation is happening and then placing the sperm after it's been washed and prepped where it needs to go. Part of the different steps in this process can help optimize your chances of success. So let's get into a little bit more of those details. Words of wisdom, 3 things to think about before you get started. Number 1, get testing. Number 2, review your goals with your doctor. And number 3, really make a plan. So what I mean is think about testing. You might not have any symptoms, you might not have any risk factors, but sometimes people do have blocked fallopian tubes and they just don't know it. There's no symptoms. So talk to your doctor before you do your first IUI about whether or not you should do an HSG or a hysterosalpingogram. Number two, think about your family goals and talk to your doctor about your goals and your personal situation. Some of my patients bypass doing IUI and go straight to IVF because of their personal situation, in that maybe they're starting later in life. They're worried about the difficulty with adding to their family in the future if they know they want to have more than one child. Common scenario could be a couple that's starting in their late 30s, early 40s. They know they want to have 2 or 3 kids. It might be easy to conceive with your first IUI, but maybe harder as you're trying to add to your family. And you can use IVF as a fertility preservation. And number 3, make a plan. You don't have to stick to it, but it's, not every IUI is going to be successful. So it's really nice to talk to your doctor about how many of these are we going to try? When do I need to think about, having another return visit with you, or think about maybe moving on to IVF or trying something different? It'll decrease your stress if you have a little bit of a plan before you get started. So, the 5 tips to think about and how to maximize your success with IUI. Number 1, think about adding medication. So, if you are having regular, predictable menstrual cycles, you're most likely ovulating, but you can add simple medication at the beginning of your cycle to help recruit the best eggs and optimize your chance of success. Talk to your doctor about using either clomiphene, or the other word is Clomid, or letrozole, and then the brand name is Femara. These 2 medications are pills that you can take for about 5 days towards the beginning of your menstrual cycle that helps with egg recruitment. It also helps optimize hormones in the luteal phase, so you have a higher chance of implantation. Personally, if I had to choose between Clomid and letrozole, I often opt for letrozole because there's typically less side effects. Clomid can often result in headaches and mood swings, sometimes even vision changes, and it can build up in your system over time and cause an increased risk of ovarian cysts or even a thin endometrial lining. So I often talk to my patients about choosing letrozole as a first step because it doesn't have the typical side effects of Clomid. Number 2, consider monitoring your cycle with ultrasounds. So one way to time intrauterine inseminations is to do ovulation predictor kits. That is much less expensive than doing ultrasounds. If you know that they work for you and they're consistent, that can be a great way to decrease cost in your care. But I often talk to my patients about doing ultrasounds because I don't want to miss anything. Doing an ultrasound in the middle of your cycle helps you make sure that there is a mature follicle with a mature egg. And it also helps us pick up on little issues. Like we always look at the thickness of the uterine lining and are trying to kind of optimize timing. So there are different ways to time an IUI, but think about using ultrasounds to monitor, because especially if it's the ovulation predictor kits are not working for you, or if you have tried it simply with ovulation predictor kits a couple of times and it hasn't been successful, think about looking in the middle of the cycle with an ultrasound to gain more knowledge and optimize your timing. Number 3, think about adding a trigger shot to your protocol and your regimen, because in the middle of the cycle, the way the egg ovulates, the pituitary gland makes luteinizing hormone to talk to the ovary to get it to ovulate. And a lot of times our body is doing a great job of doing that, but sometimes if we add a trigger shot, it not only really lets us know when you ovulate and helps us time the intrauterine insemination, but it also encourages your own ovaries to make more of their own progesterone for at least a week after that shot. So it also helps optimize the luteal phase, or the second half of the cycle, when an embryo is implanting. Number 4, optimize the sperm counts and the sperm parameters. So especially if you're doing IUIs because there's a mild male factor or a moderate male factor, off like borderline counts, borderline motility, try and figure out why. Try to optimize the counts. You can do this before you even start doing IUIs, or if the first 1 or 2 IUIs is not working, think about ways you can improve counts and improve your overall health. things that you can do, or you can do hormone testing. You can see a male fertility urologist for a little bit of a checkup. Think about medications that you're taking. Think about lifestyle optimization, like limiting, no tobacco, really very rare alcohol. Marijuana has been shown to decrease sperm count, sperm motility, et cetera. Make sure you're getting sleep, stress management, all of these things, but really think about optimizing your health and getting the best sperm parameters possible to increase your chances of success with IUI. And number 5, this goes for the female partner as well, or the person with ovaries and a uterus. So optimizing your health will optimize your reproductive health, nutrition, fitness, stress management. We can't eliminate stress. We can't cut it out of our lives, but we can learn how to manage stress, self-care as ways to decrease its impact on our overall health and well-being. So let's recap. What are the 5 tips for improving your success rate with your IUI? Talk to your doctor about these, but you could consider adding medication like letrozole or Clomid. Number 2, you could add monitoring to the cycle in the middle of the cycle, double checking the follicle size, the uterine lining, making sure everything is ideal. Number 3, you can add a trigger shot to the protocol as a way to time the insemination and improve the production of estrogen and progesterone in the luteal phase to help with implantation. Number 4, you can optimize the male factor, the sperm health, if you are doing IUIs for mild male factor or for unexplained infertility. And number 5, that goes for both partners. So reproductive health is essential, and think about all of the ways you can optimize your health to improve your chances of success with IUI. The chances of success with one IUI are not more than 15 to 20% each time you try. And that might be even lower in certain circumstances. As the eggs and sperm age, like as we get closer to 40, the chances might be even lower than 5%. And so it's important to realize and set your own expectations for the chances of success. I want all of my patients to get pregnant and have a baby with their very first IUI, but I want to help them understand the chances of success, setting their expectations, and helping them realize that it really might take more than one IUI. So if the first one doesn't work, talk to your doctor about options, but more than likely you're going to try again. And I truly hope that it is successful for you. The fertility story this week is about a patient that conceived with her first intrauterine insemination. She was a 31-year-old married woman who said she'd been trying to conceive for about 2 years without success, and she wanted to learn about her options. She started the consult with, "Dr. Shahine, is IUI a waste of time? Should I just do IVF to have my baby?" And I said, well, maybe, but let's learn a little bit more and talk about all the options first. We went through her medical history, her menstrual history, her partner's history. And I always ask a little bit more about trying. I say, what does trying to conceive mean for you? How often are you ovulating? How often are you guys trying? What time in the cycle, etc.? Long story short, the couple actually was unable to have intercourse. She was pretty embarrassed admitting this to me. He was pretty embarrassed as well. But I'm so glad that they were able to share this with me. Part of their difficulty was she had discomfort with trying, and he had some erectile dysfunction. We talked through all options. We talked about IUI, we talked about IVF, but we tried with IUI first because the biggest issue is that they've been unable to truly have a chance at conception. I'm so happy to report that they conceived with their very first IUI and they have a beautiful baby. And I love thinking about this patient. I've learned so much from this particular story and for caring for people through the years. You can never assume anything. When someone says that they're trying, you've got to understand exactly what that means. There's so much stigma around being able to try and what intercourse is and timing, but there are a lot of patients out there that are unable to actually have intercourse, and that does not mean they have to go straight to IVF to have a baby. There can be some simple treatment options before that point. And another big important point from this couple is we didn't just focus on having a baby. That was absolutely the reason that they were coming to see me and the most important goal at that point in their life. But I also connected him with a urologist to do a full evaluation for erectile dysfunction. I connected her with a physical therapist to work on discomfort with being intimate because she wanted this to be a part of their relationship. I also referred the couple to a sex therapist because they wanted to be intimate, but sex had become all about baby making, and they really wanted to work on intimacy with a therapist. I'm so happy that this couple has their baby, and I learned so much from caring for them. I truly appreciate their being vulnerable with me because I was able to help them in a lot of different ways. I hope you found the tips in this episode useful. Whether you're thinking about intrauterine insemination or you have tried one or two so far and you're thinking about trying again, I hope that you take away these tips and they are helpful for your fertility journey. Find this episode and all others at my website, drlorashahine.com. You can find more information, links to my YouTube channel, Instagram, TikTok. I love educating. Share your own fertility story and topics you'd love to learn about, people you want to be interviewed on the show. Send this information to hello@drlorashahine.com. Thank you to my producer, Shannon Perry, and her team at Audiotocracy. This is your host, Dr. Lora Shahine. See you next week, and until then, wishing you love, luck, and pineapples.